Hi everybody, welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already subscribed below, thank you so much for your love and support. I'll see you. I upload my nursing educational videos every 2 days. So you don't want to miss that out. Check out the hit the subscribe button and hit the notification bell para naman you're always updated every time I upload a video. Now, this is another entry natin sa ating nursing test banking. Kung hindi mo pa napapanood yung other nursing test banking videos I created on my channel, which is a bunch of them para naman tulungan ka ngayong darating na board exam. I'll be putting the actual playlist link on the description box. Check that one out, or whenever the icon button pops out, click that one out because I'll be putting it there together with the other playlist I have on my channel. Now, without further ado, let's jump into the video. Ayan, how are you guys, everybody? How are you guys, everybody? How are you doing, everyone? So, napakalaking pasasalamat ko nga sa inyo. We just hit 16,000 subscribers and I could not believe how many nursing students and nursing professionals are actually subscribed to my channel. It's been a while since the last time I did a nursing test banking video and I feel like this is the perfect time kasi marami akong kakilala na magte-take ng board exam at alam ko na marami mga nursing students dyan na magte-take ngayong, if I'm not mistaken, November. Tama ba? Kailan ba yung next na PNLE? But this video ay alay ko para sa inyong lahat. Now, the scope of this nursing test 2 is parallel to the NP2, National Licensure Examination Coverage. Now, ano-ano ba yung mga nilalaman nito? You can expect a bunch of questions from maternal and child health, community health nursing, communicable diseases, integrated management of childhood illness. So yun yung mga questions na may encounter nyo. Yun yung mga concepts na mga questions na to. So magandang panimula ito para naman maging prepare ka ngayong darating na board exam. Now, without further ado, let's start this discussion with our objectives. Let me share to you. So we only have 2 objectives whenever we do a nursing test banking video. One, I will be providing and discussing to you board exam type of questions. I'll be giving you rationalization per each board exam type of questions. So take note. Now, let me give you the instructions for today's examination. You will be given 10 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each questions. The answer is revealed instantly after each questions with rationalization. Choose the letter of the correct answer. Good luck, nurses. The way you want to approach this exam, this video, is as if you are actually taking the actual board. I-manifest mo na. Umupo ka dyan. Pakinggan mo yung boses ko, sabay tayong sumagot sa mga tanong. Okay, so, alright. Mag-stretching na kayo ha. 10 board exam type of questions ito. Handa na ba kayo? Handa na. Eto na galaw-galaw mga nurses for our very first question for today. Board exam type of question number 1. The student nurse is assigned to take the vital signs of the clients in the pediatric ward. The student nurse reports to the staff nurse that the parent of a toddler who is 2 days post-operative after a cleft palate repair has given the toddler a pacifier. What would be the best immediate action of the nurse? Itong sitwasyon, nurses, makinig, himayin natin tong tanong na to. May post-op kang toddler na patient, cleft left palate repair. Bingot ang bata. Binigyan daw ng pacifier yung toddler na 2 days post-op. Post-op. Ano ang immediate action mo as a nurse? Post-operative care pa rin ito. Is it A, notify the pediatrician of this finding? Is it B, reassure the student that this is an acceptable action on the parent's part? C, discuss this action with the parents? Or D, ask the student nurse to remove the pacifier from the toddler's mouth? Your 5 seconds starts now. Time's up. What is the answer, nurses? Very good. Letter C. Discuss this action with the parents. Nothing, itong rationale, makinig. Nothing must be placed in the mouth of a toddler who just undergone a cleft palate repair until the suture line has completely healed. Post-op, bibigyan mo ng pacifier, sasapakan mo ng pacifier sa bunganga, hindi pa natatanggal o hindi pa nag-heal yung suture. Baka naman matanggal yung suture, girl. O di bali, wala yung repair. Tama? Does it make sense? Yes, absolutely. It is the nurse's responsibility to inform the parent of the client. Spoon, forks, straws, and tongue blades are other unacceptable items to place in the mouth of a toddler who just undergone cleft palate repair. The general principle of care is that nothing should enter the mouth until the suture line has completely healed. Period. Malinaw ba sa inyo yon? Malinaw, absolutely. All right, board exam time for question number 2. The nurse is providing a health teaching to the mother of an 8-year-old child with cystic fibrosis. Familiar ba kayo sa concept ng cystic fibrosis? Itong tanong na to ay para sa inyo, para ma-refresh kayo. Now, which of the following statement, if made by the mother, would indicate to the nurse the need for further teaching about the medication regimen of the child? Ang sitwasyon, nurses, meron kang nanay na kausap. Ang anak niya diagnosed with cystic fibrosis. Alin daw dito, negative statement ang hinahanap dito. Alin dito ang na statement ng nanay na kapag sinabi niya, mali. Kasi it requires further teaching. This type of questions, mag-iingat kayo kasi negative statement ito. Ang hahanapin mo dito, itong 4 na to, 3 dyan tama. Isa dyan ang mali. Alin yung mali, yun ang sagot mo. Gets. O basahin ko sa inyo yung choices. My child need an extra capsule if the meal is high in fat. B, I'll give the enzyme capsule before every snack. C, I'll give the enzyme capsule before every meal. Or D, my child hates to take pills, so I'll mix the capsule into a cup of hot chocolate. Your 5 seconds starts now. Time's up, you guys. What is your answer? Very good. Letter D. My child hates to take pills. So, I'll mix the capsule into a cup of hot chocolate. Ano yung nagpamali sa statement na to? Sabihin ko sa inyo, hot chocolate. Bakit? The pancreatic capsules contain pancreatic enzymes that should be administered in a cold, not hot, medium medium to maintain the medication's integrity. Ano ba yung mga example nito ng mga medium to hot, cold to medium temperature drinks? Chilled applesauce versus hot chocolate. So, hindi mo siya ibibigay kasi mababasag yung integrity ng capsule mo, mawawalang bisa. Yung gamot, yung pancreatic capsule, right? Okay, we're talking about medication and the route and the way of administration of medication. Malinaw ba sa inyo yan? Malinaw. Board exam type of question number 3. The mother brought her child to the clinic for a follow-up checkup. The mother tells the nurse that 14 days after starting an oral iron supplement, her child's stools are black. Which of the following is the best nursing response to the mother? Nag-iron, Nag-iron vitamin supplements ang batang for 14 days. Ang bata. Ang sabi ng nanay, nagkakaroon ng bakit kulay black daw yung taing niya, taing ng anak niya. Ano yung best response mo sa nanay as a nurse? A, I will notify the physician who will probably decrease the dosage slightly. B, this is normal side effect and it means the medication is working. C, you sound quite concerned. Would you like to talk about this further? Taray, lakas maka-psychology. Letter D, I will need a specimen to check the stool for possible bleeding. Your 5 seconds starts now. Very common itong tanong na to. Anong sagot? Very good. Letter B. This is normal side effect and it means the medication is working. Now, tandaan nyo, nurses, here's the rationale. Makinig. When oral iron preparations are given correctly, the stools normally turn dark, green, or black. Parents of children receiving this medication should advise that this side effect indicates the medication is being absorbed and is working well. Diba nga empty stomach natin tinitake ang iron supplement para lalo siyang ma-breakdown sa normal environment ng stomach? Tama natin, which is made of hydrochloric acid. Isa pa, madalas na ina-administer yung iron supplements together with vitamin C for better absorption. So, normal sa isang bata na magkaroon ng black stool kapag nag-iron supplement. Ang hindi normal, yung nagba-black stool ka, nagmemelena ka nang wala kang tinitake na iron supplement or there's no other sources. You know what I mean? So, malinaw ba sa inyo itong tanong na to? Malinaw. By the way, before further proceed, kung hindi ka pa nagsasubscribe, mag-subscribe ka na sa channel ko, Pangpalaki Charm. Hindi ba? Eto na talaga. Board exam type of question number 4. An 8-year-old boy with asthma is brought to the clinic for checkup. The mother asked the nurse if the treatment given to her son is effective. What would be the appropriate response of the nurse? Appropriate response ng nurse. Lahat, pag nakakita ka ng mga ganyang klaseng tanong, ibig sabihin, lahat, tatlo dyan mali, isa dyan tama. Or the best answer. Pwedeng lahat yan tama, pero isa dyan the best answer. Ang scenario, nurses, makinig, himayin natin, 8-year-old boy, asthmatic. Tinatanong ka, nagre-receive siya ng treatment for asthma. Paano mo daw, tinatanong na effective ba yung treatment na nare-receive ng anak ko, ni baby boy? Anong best response mo? Is it A, I will review first the child's height on a growth chart to know if the treatment is working? Is it B, I will review first the child's weight on a growth chart to know if the treatment is working? C, I will review first the number of prescriptions refills to the child has required over the last 6 months to give you an accurate answer. Or D, I will review first the number of times the child has seen the pediatrician during the last 6 months to give you an accurate answer. Tinatanong ka, effectivity ng course of treatment for asthmatic 8-year-old boy. Your 5 seconds starts now. Time's up, you guys. What is your answer? Very good. Letter C. I will review first the number of prescriptions refills the child has required over the last 6 months to give you an accurate answer. Tinitingnan mo dito, may measure mo dito yung exacerbation ng asthma. Pag marami siyang nagamit na prescription, marami siyang na-refill ng prescription, ibig sabihin, dumadalas yung asthma attack niya. So, effective kaya ang treatment mo? Hindi. Kasi mas marami kang prescription. Now, let me give you a detailed rationalization. C nga po ang tamang sagot. Bakit? Reviewing the number of prescription refills the child has required over the last 6 months will be the best indicator of how well controlled and thus how effective the child's asthma treatment is. What did I tell you? Breakthrough wheezing, shortness of breath, upper respiratory infections would require that the child take additional medication. This would be reflected in the number of prescription refills. Period. Eto na tayo. Board exam type question number 5. Nangangalahati na tayo ha. By the way, pakilagay yung mga score nyo sa baba. I would love to evaluate the scores of my students. Bago ko basahin yung tanong, I want you to understand, balik tayo sa intention. The reason why we're doing such nursing test banking videos like this is because I want you to be familiar with the rationalization, kung paano i-approach yung mga tanong sa PNLE, sa PROMETRIC, sa NCLEX. Kapag kaya mo siyang himayin, you know how the rationalization, kahit pagbalik-balik ta rin ng tanong, nauulit yung mga tanong, nare-recycle, naiiba lang ng form, pinabago lang ng bahagya, alam mo kung paano siya sagutin because you exactly know why that is the right answer. So, hindi importante kung gaano kataas yung score mo for now, but I want you to really have the full grasp of the rationalization. Is that clear? Taray, di ba? O clear. O thumbs up mo kung clear. Alright, let me read to you board exam question number 5. The nurse is caring to a child client who's receiving tetracycline. The nurse is aware that in taking this medication, it is very important too. Ano ang nursing prioritization mo or nursing consideration mo if a patient is receiving or taking or is ongoing tetracycline therapy? That's the question. Is it A, administer the drug between meals? B, monitor the child's hearing? C, give the drug through a straw? Or D, keep the child out of the sunlight? Your 5 seconds starts now. Time's up, you guys. Very easy question. Letter D is the right answer. Keep the child out of the sunlight. Bakit? Simple rationalization. Tetracycline, you guys, kung nakakalimutan nyo, let me remind you that this may cause a phototoxic reaction. Phototoxic reaction. Alright? Patients who's receiving this become so sensitive to light. That's why you want to keep them out of the sunlight. Malinaw ba yun? Malinaw. Board exams have question number 6. A 14-year-old infant with cyanotic heart defects and mild congested heart failure is brought to the emergency department. During assessment, the nurse checks the apical pulse rate of the infant. The apical pulse rate is 130 beats per minute. Which of the following is the appropriate nursing action? Pag may mga ganitong tanong, you guys, tandaan mo lagi yung mga normal values mo. Kagaya nito, binigyan ka ng given 130 beats per minute ang heart apical pulse mo. Titingnan mo yung edad ng pasyente mo. 14-year-old infant. Tama, ang case mo, cyanotic heart defects and mild congestive heart failure. Normal ba ito sa kanya or abnormal? Kasi doon magde-determine kung ano yung nursing action mo. That's how you're gonna approach it. Alright, so let me read to you the choices. A, retake the apical pulse in 15 minutes. B, retake the apical pulse in 30 minutes. C, notify the pediatrician immediately. D, administer the medication as scheduled. Your 5 seconds starts now. Time's up, you guys. What is your answer? Very good. Letter D. Administer the medication as scheduled. Bakit? The normal heart rate of an infant, listen, is 120 to 160 beats per minute. So itong beats na to ng apical pulse mo, normal ba yan? Normal. Kaya you will proceed with medication administration as scheduled. Alright? So gamitin nyo tong mga mga visuals ko dyan para sa lahat ng mga visual learners natin. Gamitin nyo yan kasi hindi ko lang siya nilagay dyan for design. Nilagay ko siya dyan kasi may purpose sila. Nandito yung mga normal values. Take a screenshot. That's all for you. Board exams have a question number 7. The physician prescribed gentamicin. Brand name, garamycin to a child who is also receiving chemotherapy. Before administering the drug, the nurse should check the results of the child's anong laboratory finding ang i-check mo. Sa isang pasyenteng nagre-receive ng gentamicin at nagkikimo. Related ito sa gentamicin administration. Anong lab values ang nakakorrelate sa gentamicin? Is it A, CBC and platelet count? Is it B, auditory tests? Is it C, renal function tests? Is it D, abdominal and chest x-rays? Your 5 seconds starts now. Time's up, you guys. Nako, easy ito sa lahat ng mga paborito ang pharma. Ito siya, ang sagot ay letter C, renal function tests. Bakit? Bakit may check yung kidney function test, yung renal function test ng pasyente mo? Kasi nephrotoxic po ang gentamicin mo. Let me give you the detailed rationalization. Both gentamicin and chemotherapeutic agents can cause renal impairment and acute renal failure. Thus, baseline renal function must be evaluated before initiating either medication. Period. Nephrotoxic. Dapat mo malaman pag mag-administer ka ng medication, saan ba siya minametabolize. Kasi, pag na-reach ng medication ng certain toxicity level niya, it could harm that certain organ. May mga medication na ototoxic, nephrotoxic, yung mga ganon. So, kailangan mo siyang malaman. Alright? So, last 3 questions na tayo. Galaw-galaw, hinga-hinga. Eto na. Board exam type of questions number 8. Which of the following is the suited size of the needle would the nurse select to administer the IM injection to a preschool child? Very simple question. Preschool child. Ang pasyente mo. Anong size ng IV cannula ang gagamitin mo? That's the question. Is it a 18 gauge or gauge 18? 1 to 1.5 inch? B, 25 gauge 25? 5/8 inch? C, gauge 21, 1 inch? Or D, sa puking kita, gauge 18, 1 inch? Your 5 seconds starts now. Nagigigil ako sa'yo, sinagot mo yung 18. Una sa lahat, hindi mo isasagot ang letter D. Bakit ka gagamit ng large bore? Sasampalin kita. Makinig, letter C is the right answer. Okay, gauge 21, 1 inch. Bakit? In selecting the correct needle to administer an IM injection to a preschooler, the nurse should always look at the child and use judgment in evaluating muscle mass and amount of subcutaneous fat. In this case, in the absence of further data, the nurse would be most correct in selecting a needle gauge and length appropriate for the average preschool child. A medium gauge gauze or medium gauge needle, 21, that is 1 inch long would be most appropriate. Malino ba yon? Malinaw. Board exam type of question number 9. A 9-year-old boy is admitted to the hospital. The boy is being treated with salicylates for the migratory polyarthritis, accompanying the diagnosis of rheumatic fever. Which of the following activities performed by the child would give a best sign that the medication is effective? Effectivity ng salicylate therapy. That's the question. Is it A, listening to a story of his mother? Maalaala mo kaya ito to. Letter B, listening to the music in the radio. Listening to the music of the radio. Or C, playing mini piano. Or D, watching movie in the DVD mini player. 5 seconds starts now. Hindi ko sure kung medyo nag-cross through itong tanong na ito sa inyo, pero wag kayong mag-alala, magko-cross through to. May mga tanong talaga sa board exam na minsan hindi mo talaga mawari kung paano nilang inano yun. Ang tataba ng utak ng mga nagfo-formulate ng tanong sa board exam. Gigigil din ako sa kanila. But the right answer to this one, handa na ba kayo? Letter C, playing mini piano. Here's the rationale. The purpose of the salicylate therapy is to relieve the pain associated with the migratory polyarthritis accompanying the rheumatic fever. Playing mini piano would require movement of the child's joints and would provide the nurse with a means of evaluating the child's level of pain. Effective ang salicylate therapy mo sa isang pasyente, 9-year-old, kapag kaya niyang i-move yung mga joints niya. Only one of these choices shows movement of the joints, and that is through playing mini piano. That's why the best answer for this is letter C. Alright? Gumamit ka ba ng piano gamit ang elbow mo? Or gamit ang dila mo? O sige. Wag ka ng letter C ang tamang sagot. Okay. Alright. Last question na tayo. Board exam type of question number 10. The physician decided to schedule the 4-year-old client for a pair of left undescended testicle. Again, left undescended testicle. That's the case. The infection of a hormone, HCG, finds it less successful for treatment. To administer a pentobarbital sodium, brand name Nembutal, suppository preoperatively to this client, in which position should the nurse place him? Simple question, nurse positioning. Magbibigay ka ng suppository kahit hindi mo alam itong nembutal na ito. Pero nasa tanong, suppository itong gamot na ito. Paano mo ibibigay yon sa isang 4-year-old client? That's the question. Are you gonna place him in a supine with foot of bed elevated? That's A. Or B, prone with legs abducted? Or C, sitting in foot sitting in foot of bed elevated? Or D, side lying with upper leg flexed? Your 5 seconds starts now. May mga tanong sa board exam na minsan kailangan mong gamitin yung imahinasyon. Kagaya nitong tanong na ito. What is the answer? Very good. Letter D, side lying with upper leg flex. Lateral side lying position nga po ang tamang sagot. The recommended position to administer rectal medications to children is side lying with the upper leg flexed. This position allows the nurse to safely and effectively administer the medication while promoting comfort to the child. Diyan na nga po natatapos ang ating video for today. Thank you so much for watching. Hope you learned something. Please like, share, and subscribe to my channel for more nursing education videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan mo yung next upload natin after 2 days. Kasi it's gonna be fun. It's gonna be great. Tulungan nyo na nga ako pamalitan nyo na sa radyong sila ang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. Also, don't forget to follow me on all my other social media accounts. Everything is at Neil Gavi except for my TikTok account, which is Neil Gavi Official. I would also like to invite you to follow me on my Facebook page. Everything, Neil Gavi po. Yan po, nagpo-post din po ako doon, and I would also like to connect with all of you guys. Ngayon naman, kung hindi ka pa nagsasubscribe, mag-subscribe ka na kung nakaabot ka hanggang sa dulo ng video na ito, and ipamalita mo na nga, spread the news about my channel. I'll see you again after 2 days. You have a good one.